Hi, I'm Elizabeth, and I have a dehiscent semicircular canal in my right ear. And what this is a hole in the bone covering the superior semicircular canal. Doctors aren't really sure what causes this, but they suspect it's a congenital weakness, thinness of the bone, and it just wore through over time under the weight of my gigantic brain. um, so this is a fairly new, fairly recently discovered condition. Dr. Lloyd Minor at Johns Hopkins discovered this and developed the surgery to correct it in 1998. So I feel extremely fortunate that my doctor here in Chicago, Dr. Clemis, was able to diagnosed me right away. As soon as I described my symptoms, he suspected what it was and did all the proper testing and CT scan, and sure enough, there was a little hole there in that bone. I've heard so many stories of many people with this condition going years, seeing many doctors, and having them tell them there's nothing wrong with them, they're just fine, it's all in their head. So I'm extremely fortunate that Dr. Clemis was on top of his game, and the first doctor I saw knew exactly what it was. So what I've been living with for the last 4 years is the main symptom is called autophony. I hear every sound inside my body is amplified inside my head. You can figure out what this feels like if you've ever had a head cold and flown and you can't unblock your ear. That's what it sounds like. Or if you just take your finger and plug your ear and speak, you know what I've been living with for 4 years. My voice is extremely loud. I hear my breathing, my heartbeat. I even hear my eyes move. It's like a swish, swish sound. If I'm chewing or crunching on something, carrying on conversation during dinner is difficult because those sounds are so loud inside my head. So it makes it hard to hear other people. My footsteps are really loud. Even in tennis shoes, it's like a low thunder, boom, 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 boom. Or if I'm wearing heels on concrete, it's like a jackhammer inside my head. Okay, so the difference between this and having a head cold or blocking your ear is that, well, there's no pain because the eustachian tube isn't actually blocked. And there's no interference with the outside noises. I have had some low-level conductive hearing loss because the sound escapes through that hole and is absorbed instead of being registered as sound. Hopefully that will be restored after the surgery. But outside noises, even with this conductive hearing loss, I don't really notice it. Outside noises actually do sound extra loud. Someone with a loud voice or a phone ringing or any sort of loud sudden noise shoots straight into my brain and actually makes me dizzy. But even just someone speaking in a loud voice next to me, it's like zzz, 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 each word going into my ear. I liken it to a cartoon character with a crashing cymbal and how they sort of get all jiggly afterwards. That's what a sudden loud noise feels like to me. So I thought I would get used to this, but it didn't happen. In fact, it's gotten worse over the last year. So I finally decided to see the doctor and figure out what this is and see what they could do for me. And that's when I found Dr. Clemis, who diagnosed me, and then I was referred to Dr. Wyatt at Northwestern for the surgery, and he came highly recommended, has had great success with the surgery, and both these doctors, Dr. Clemis and Dr. Wyatt, are great doctors and have taken all the time I need to reassure me, explain everything, make sure I'm educated and knowledgeable on the syndrome and what I'm facing with the surgery, and so I'm excited to get this surgery done. So what they're going to do is it's called a middle cranial fossa and surgery and approach, and they will shave a little bit of hair here, cut my skull open, lift my brain out of the way, take a piece of the bone, cover the hole, throw some epoxy over that, slap my skull back in place, and I'm good to go. And I'm looking forward to hearing normally again and being able to live without all this noise inside my head. I will get back to you after the surgery and let you know how it went and tell you what to expect after that. Thank you, and I'll see you soon.